Welcome back. More serious subject now as we turn our attention to our oral health with Dr. Preety Desai. Welcome back to the show.
Thank you so much.
Yes, thank you for being here. We are talking a little bit today about the effects of recreational drugs on your overall mouth and oral health. It can be quite devastating.
It can be, and of course, the oral side effects are minimal compared to the more serious systemic side effects.
Yes.
So obviously, I don't want to minimize all that information because, of course, all the information in the news about fentanyl and carfentanil, these are all depressants on the systemic system, your brain, your emotion, but also your breathing and your heart. And that's how all these accidental deaths are happening, is it depresses your systemic systems.
Right, right. And so with the whole crisis of the overdose situation going on, it's terrible, certainly.
Yeah.
But what some people who might not realize is that it affects as much as, you know, just opening your mouth, you smile, and it really has an impact.
Exactly, and part of the systemic system is your secretions go down in your body, which includes your saliva. And what that does is increase your cavity rate and your deterioration. We actually have a term in the dental field called meth mouth, methamphetamine mouth. And it's a very distinctive look, unfortunately, and we have some photos to demonstrate it. But it is, the cavities occur on particular surfaces of the teeth. There is complete attrition and wear of the edges. You're grinding your teeth. And the rate of breakdown is almost 100 times faster than naturally occurring disease in the mouth.
Wow. Let's take a look.
It's absolutely terrible.
So we're looking here at obviously
these are obviously some crystalline street drugs that are some concoction that we have the street name of rock salt is one of them.
Okay.
This is a very typical meth mouth look, which may be kind of gross at lunchtime, but certainly it has that ring of halo right at the edge of the gums, and also the smoking and the dryness of the mouth creates this dark, kind of grungy kind of look to it.
The brown bits in there, what
the
are
brown
those?
bits are deterioration, staining, and cavities.
Yeah.
Yeah.
Yikes.
And these are, of course, a famous person who has deteriorated systemically, and this is a very sad situation, but unfortunately it makes the news, so it's easy to demonstrate the negativity of the breakdown. And another famous person, but if you focus in on her mouth, you'll be able to see in the next photo that this is the way she used to look.
Right.
And then the next photo is how quickly she deteriorates. This is within weeks.
Wow.
It goes that quickly in the mouth. So as the systemic situation also changes, the mouth situation mimics that. And so we call these mouths meth mouths. Yeah, unfortunately.
What can be done for somebody who has, you know, perhaps had a drugs history, but they want to clean things up?
Well, of course, the first thing is to deal with the overriding situation of why they're using drugs in the first place, which, as my husband, who works in the ER all the time, says, it's mainly depression and other life things. If you can get that a little bit under control, they can get therapy, then it is worth spending the time and the money to fix the mouth up, because then, of course, that's your smile, that's your positive influence, that's your lack of negativity when people look at you and they know exactly what you have gone through because they know how quickly you've gotten there. So in order to hide that, you have to kind of deal with the big package, unfortunately, all at once. We try to do bandage problems of pain control, etc., but it's very complicated to deal these kind of patients. They really are. It's kind of beyond the average dentist's, you know, capacity to deal with it because it's more superseded.
Okay, Dr. Desai, thank you for being here today.
Pleasure.
Good information to have. If you have questions for Dr. Desai, you can absolutely get a hold of her through her office. The website's on the screen, so is the phone number. We're back after a quick break. Stay with us.